a short case presentation, atrial fibrillation with relative contraindication for oral anticoagulants in elderly patients, being presented by Dr. Sudeep Verma from Care Hospital.
I'd like to thank Dr. Saibalkar, with whom we did this case almost a year back. So I am just skipping the other because already it was all discussed. What's the importance of LA? So I just want to mention this: the contraindications which are absolute are the deranged liver function, baseline with INR greater than 1.5 with renal impairment, significant thrombocytopenia, bleeding conditions, esophageal varices, and hypersensitivity. Apart from that, the relative contraindications are this, and in particular, the age more than 65 years, previous history of bleed, uncontrolled hypertension, and acute apparent low platelet. These are the which shows the relative contraindication to the anticoagulants. So I am going to present the first case what we did with the Dr. Saibal almost a year back. So she is around 60-year-old lady, known case of hypertension on medications which was poorly controlled with the BP at the time of intervention of 150/94. History of peptic ulcer disease was present and she is grossly obese with weight of 90 kg with poor compliance to the drugs and presented with shortness of breath class 2, giddiness and palpitation. ECG shows AF with fast ventricular rate. That's why I showed the first relative contraindication, because it's all 68-year-old lady with poor compliance with history of peptic ulcer disease, obesity and all. We decided we'll go with the LA appendage closer. So this is the procedure details. This is the first slide that shows the after septal puncture we entered into the LA, and this is the angiogram that shows the LA appendage injection. After entering into the LA with the MPA catheter and exchange with the emplazanin to the 12 French sheath, this is the injection done with the hand in the appendage that shows the wide appendage mouth and the appendage profile. So these are at that time the available device was the Emplatzer device. So we thought we'll go with the Emplatzer device. So these are the profiles for the Emplatzer cardiac plug. Now over the period the Emplatzer cardiac plug also improved over the period of time. Now the Emplatzer cardiac plug 2 also came, which has got more improved version of the Emplatzer cardiac plug. So the device choice is in general is the 14 to 10 plus minus 10% oversizing at the diameter of the LA orifice, and the size ranges available is between 16 to 30. So if you think after seeing the T, we saw the LA orifice size was around 24. So over that we oversize with the some 15 to 20%, it comes out to be 30. So we decided to go with the 30 device. So this actually, it's not only the LA appendage, actually the landing zone is also the important, because it's where we are going to place the proximal disc, and the distal disc is over the orifice size. So these are some other pictures from some other that shows the dimensions of the LA orifice as well as dimension of the landing zone. So after we decided to go with the 30 devices, this is the opening up of the distal disc into the LA appendage. This is the 12 French sheath, because the 30, it's the sheath which usually comes with the device itself, plug itself. So this is the deployment of the proximal disc, and this is the fully deployed disc. So you can see after the release device, there is absolutely no flow across the LA appendage. Sorry. So this is the check angiogram. Then that shows there is no obstruction to the pulmonary vein, as well as that I tell you afterward, because the T images are also there, and there is no obstruction to the mitral wall. So it shows a nice device position as per the procedure wise. It's a simplified procedure. So this is the T images during the procedure. You see this is the LA appendage. The mouth measures around 24 to 25 mm. So we decided to go with this is after entering the LA, the sheath. This is the contrast we fill into the LA that shows the filling up of the LA. This is the LA you see in the biplane LA appendage. That shows is the wide, because if you see only in the one plane, LA appendage looks small, so you can grossly undersize the LA device, appendage device. So it's always better to look at the biplane level, so that you can able to give the good size and appropriate size for the LA appendage. This is the device entry into the LA appendage, and this is the distal disc into the LA appendage. And now this is deployed distal disc, and it is nicely placed, and this is the final one. You can see the device is nicely placed with the adequate position. It's not causing any harm. So this is the board. This is the position of the device we are checking with, like equivalent of the wiggling what we use in the ASD device. So it's a no malposition of the device. Device is nicely positioned, and there is no mitral wall obstruction. So this is the deployed plug finally. So just a short we tell, it's a post-procedure event was the uneventful. The lady discharged after the third day with the adequate control medication. Just to tell, it's not only the device is the appropriate form that's already discussed. It's just the first case we did here with the Dr. Saibalkar, who is pioneering doing all those things. So I thought we'll present this case whenever it's to talk about the medical as well as the appendage therapy. That's all. Thank you for.
How many cases have you done so far?
Only one case. This is only one case. We did that too. We did with Dr. Saibal in last year.
Well done. Thank you so much.
Thank you for giving me the opportunity. Thanks a lot.